And welcome. My name is Melanie Flowers, and I am the Chief Workforce Strategy Officer here at Craft Education. And I am thrilled to be moderating today's conversation, growing and scaling your university's healthcare career apprenticeship programs. So I'm looking here through the chat. It's amazing. We have people from all over. We've got Florida, we've got Texas, Massachusetts, Arizona. Welcome to all of you, and this includes our great panelists. So all of these seasonal activities look fun. Pumpkin carving, looks like a lot of, let's see, apple, looking into the fall colors, corn maze. Oh, that's cool. That would be cool to do. Lots of fun fall activities. So today we're joined by visionary leaders in the apprenticeship and healthcare sectors who have greatly impacted the future of apprenticeships and healthcare in the healthcare industry. Before we get started and meet our panelists,
I think Melanie froze, and I think I'm seeing panelists say that they're experiencing the same thing.
Oh,
yes.
Oh, Melanie, it looks like you're back. Back to
okay. All right. What was the last thing you heard?
before we get started. ...
Oh, wow, really? Okay, let me back up a little bit. So let's say, before we get started, let's get to know a little bit about you that are in the audience with us today. Take a moment to answer the poll that pops up on your screen and let us know the role that you currently play in the. So we'll wait a couple minutes for that. Thank you for that, Mallory. I didn't, oh, I was talking to myself. I didn't realize that. Technology, I always say it's our best friend and worst enemy. More people are continuing to join us. WorkSource Georgia Mountains, National Healthcare Partnerships at Rise Point. Awesome. All right, so let's see here. Many of you are directing or managing programs already. Some support the students and operations, work with state apprenticeship agencies. Very good. Wide range of players in the field. So that's awesome. That's awesome to hear. So thank you for those responses. One quick housekeeping note before we dive in. We'll be saving time at the end of the webinar for Q&A. So feel free to drop your questions in the Q&A box at any time during the session. The team will be keeping an eye on the questions, and we'll make sure we get as many questions as we can answered at the end. And so before we dive in, let's explore the goals for today's session. So today we're going to understand why behind this, the why behind registered apprenticeships and their role in solving workforce challenges. We're also going to learn from real examples of launching, scaling, and sustaining RAPs, including funding and program design. We will also explore what makes RAPs work, from the stakeholder partnerships to shifts in accreditation and prep models. So now let's hear from you in the chat again. Where are you with your goals in launching, scaling, or exploring building a registered apprenticeship program? So drop the stage you're in the chat, and then that'll kind of help us focus where we're answering our questions for you. So drop a 1 in the chat if you're exploring, drop a 2 if you're launching or preparing to launch, 3 if you're scaling and expanding, and 4 if it's other. So we have a few 1s, couple 3s, couple 2s. Okay. Good. So we're good. We've got a wide range of levels or phases in the programming, so that's pretty good. So thank you all for sharing that. And let's kick things off today by meeting our panelists. I'll invite each of them to briefly introduce themselves and share a bit about their work and the work that their work and what they're doing in the space. So first up, we have Mamie Williams.
Hello, everyone. I'm Mamie Williams. I am thrilled to be here and to have this discussion with you all. I am a nurse by a background, and really I've served in all the different roles within nursing. So I've been an academician, an ICU staff nurse, a clinical nurse specialist, just all the various different roles. I think most nurses serve more than one role at any given time. But I want to share something with you too. Nursing for me is a second career. I started off in research and public health and fell in love with the field of nursing. And because at the time when I fell in love and decided I wanted to go back to school, I didn't have any immediate family obligations, I could pursue it. And despite still needing to work full time to pay bills, I was able to accommodate, and my employer worked with me as well. At the time, I did not realize just how transformative becoming a nurse would be for me. So it not only reshaped my life, but my family's trajectory. There are now, because of my example, a total of 5 members in my family who are nurses. I have a sister, a niece, and some very close cousins who followed suit and became nurses. So it has changed the trajectory of my family's life as well. We went from having no one in healthcare to now it's essentially like a family business, and we have care and purpose and stability. So my witnessing that kind of ripple effect really deepened my commitment to expanding nursing pipelines and pathways into nursing, because not everyone has the opportunity the way that I did to be able to pursue it, but they may have the passion for it. So I have a passion for strengthening the pipeline by creating accessible and supportive entry points for others. And along the way, because of that work in my work in nursing workforce development and pathway expansions, I've been able to work to begin a medical assistant training program, an in-house medical assistant training program for entry-level employees at a hospital system, and then an LPN transition to practice program. And those efforts just really reflect my work to transform and begin with this well-designed pathways that allow anyone who has that desire to be a healthcare provider to be able to pursue it. So that's kind of me in a nutshell. And my favorite fall thing is fall gardening.
Awesome. Thank you so much. I'm looking forward to diving in, and we appreciate you being on the panel. Next up, we have Joy Jamerson.
Hi, everyone. I am Joy Jamerson. I have over 20 plus years in workforce. Yeah, like people may say that I don't look like it, but yeah, I'm old. So I started out my career in higher ed and, did higher ed, did private sector, did nonprofit, and I always found myself within higher ed and workforce development. And then when I got in this position around apprenticeships, I was coming out of a position where we developed curriculum and we started hearing the word registered apprenticeships, but it really wasn't something that I knew about, right? Like what is this? What is this new thing? And if you remember 5 years ago, it was all about industry-based credentials in the workforce development sector. But when I learned about what a registered apprenticeship program is and how effective it was, I fell in love with the program and immediately thought, where was this program when I was in high school? So I am the program manager here at HCAP, and one of my major job duties is to make sure that everyone across the U.S. learn about registered apprenticeships, and then I also help them build and expand their registered apprenticeships throughout their counties, in their rural areas, in their urban areas. We're all things registered apprenticeships here at HCAP, and we are a national labor management organization and a national intermediary with the Department of Labor. So that's me in a nutshell. And my favorite fall thing is what I do every day. Give me a good book with some good weather in my patio, and I am a-okay.
Awesome. Awesome. Thank you for that, Joy. Welcome also to the panel. We want to welcome also from HCAP, Madeline Boehm.
Hi, thank you very much. And Yeah, I've been in apprenticeship for about 10 years. I started in 2015 working for the state of Montana, developing registered apprenticeships in healthcare there. Previously to that, I worked in healthcare regulation for almost 10 years. So have that kind of experience. You know, healthcare is one of the most regulated industries in this country. So being able to understand and figure out how those regulations work when we're building apprenticeship programs is very important. So
Yes,
I am glad to be here today. Thank you.
absolutely. Thank you. And last but not least, I would like to introduce our president, Dr. Mallory Dwinal Palisch.
Hi, everyone. My name is Mallory. It is so nice to be here with you all, though certainly as the least qualified person on this panel. I will say the only thing I would add is, Joy, people tell her she doesn't look old. I don't get that. People tell me I look old all the time. So I am both the least qualified and the most aged, I suppose. I started out actually in the teacher apprenticeship side. So first doing my PhD research in these sort of grow your own localized models, then working as a practitioner, as a K-12 teacher, and then as a school principal, before working full-time in the launch as the founder of Reach University to do teaching apprenticeship degrees. And the reason craft exists and the reason we're all here today kind of goes back to this question of what happens when the profession that you are trying to prepare people for requires a college degree. And how does that change things? And why is it so important that we figure that out, right? Why is it so important that we figure out how to have nursing degree programs like teaching programs or social work programs that actually operate as an apprenticeship? And so certainly the least qualified to speak in any way on nursing in particular, but really excited to chime in on the impact we see when universities lean into apprenticeships for the professions that require their degrees and their training.
Yes. And so with that, Mallory, before we dive in into how to launch and scale a registered apprenticeship program today, we'd love to hear from you about the why behind apprenticeships. So this is from looking at the statistics on this slide that projected 100,000 shortage in healthcare workers. Seems pretty impactful that on our nation's healthcare system, but the 169% growth in apprenticeship programs seems promising. So will you share with us why are healthcare apprenticeships at the university level so?
Absolutely. And it looks like Melanie froze again. So I'm just going to dive in and play my favorite ad libs of what did she say next, which is why at the university level are apprenticeships so important. So the way I want to talk about that is first, why do apprenticeships in general, why are apprenticeships the right way to ending skilled labor vacancies that create a win-win? And then take a quick moment to go back to that point of, and when we're talking about something like nursing, that is inherently, we are talking about apprenticeship degrees with 2- and 4-year institutions, because you cannot, nor would we want you to be, a nurse without that college degree. So let's first go back to apprenticeships in general and why they're really important in this context. Apprenticeships create a win-win-win, especially in these public goods and services like healthcare or education. And I think about it in terms of why it's good for the employer, why it's good for the learner, and perhaps most importantly, why it's good for the communities they serve. So starting with employers, nursing is, especially amongst new nurses, a very high turnover field. And we see a ton of attrition that is really costly for employers. The average estimate is that a hospital in the United States spends, again, as an average, $4 to $5 million a year on nursing shortages, on the costs associated with having to close beds, with running afoul of nursing patient ratios, et cetera. And so for the employer, being able to have a stable, predictable pipeline of people that are from that community, are going to stay there longer because they've been prepared better, and who are specialized into the exact types of nursing that they might need, right? A hospital might have a need for ICU nurses or LVAD nurses or whatever it is, making sure they have the exact nurses they need in the exact seats, and that those people have been prepared in a way that they are going to stay longer is good business for the employer. For the learner, apprenticeships offer a way to dramatically increase their income and their family trajectory, like Mamie said. There's so much evidence that healthcare becomes an anchor profession for individuals where it doesn't just change their life, it creates a floor that changes the trajectory of their families' lives. And so when we're talking about jobs that, hey, I can become a registered nurse, and on average, a registered nurse makes 150% more than the people that are in the positions that filter into that through an apprenticeship. So I can grow my salary by 2.5 to 3x by virtue of completing this program. That's a big deal. It means that individuals have a way to earn the credentials they need to provide for their families, to give back to their community. And we're not asking them to choose between that future that they want and the job they need to have today to provide for their families and to take care of their basic needs. So that creates immense opportunities for economic mobility into high dignity, high impact, family sustaining wage professions for the learner that has, again, Mamie said it anecdotally, but what we see play out statistically at a structural level, family change beyond just the impact on the individual that goes through the program. And then that brings us to the most important piece, perhaps, which is the communities they serve. Um, there are so many clear statistics. As just two examples, when patients are treated, when one thing that matters to me as someone who is 38 plus weeks pregnant right now, when patients who are treated by healthcare providers who share their ethnic and linguistic backgrounds, maternity rates or maternity mortality rates fall dramatically. When critical access hospitals, especially out in remote rural areas, have access to local talent development, their odds of staying open go up significantly. And so when we think about the impact of apprenticeship nursing pathways beyond the financial gain for the employer and the economic trajectory for the learner, we're really talking about a public health opportunity here that is not matched by many other levers that we've been able to pull in society, right? To staff healthcare facilities with people who are from the communities they're serving, who are a part of that community long term, and who as a result get really structurally different outcomes in terms of patient health and in terms of just keeping the access that those patients have open and available. So that's why apprenticeships matter. And then the last thing I'll say before I pass it back to you, Melanie, is the big thing that we cannot ignore in nursing, as with teaching, as with social work, is that for very good reason, there is no such thing as becoming a nurse without a college degree, right? Even if you do a post-baccalaureate apprenticeship degree, you have to have a bachelor's of science in nursing. You have to go through and pass the NCLEX exam. And I am glad for it. No one is sitting here arguing that it should be any different. But it means that as we talk specifically about, to your question, Melanie, why this is so important for universities, we can't afford for 2 and 4 year institutions not to play a role in this and to think about themselves as RTI, related technical instruction providers, if we want to get serious about doing for the healthcare space what apprenticeships have done in other industries and spaces. So that's my 2 cents, and I'll pass it back to you, Melanie.
Thank you. Again, we talked about technology being your friend. I don't know what's going on with this freezing stuff, but we'll push on. But thank you for sharing that very insightful perspective, Mallory. And now that we've talked about the why and the impact and the urgency to build and launch healthcare career registered apprenticeship programs, let's discuss the how. And so let's talk about launching and scaling these programs. So now we're going to pass on to our panelists. I want to start with Joy. Joy, from your experience in supporting educational institutions with launching and scaling their healthcare apprenticeships, what have been your greatest challenges and successes in helping launch the registered apprenticeship program? And is there any advice that you would give institutions still exploring the possibility of launching a RAP?
Thank you. Challenges. Woo, it's a long list of them, just playing. The main things that I see is that the communication isn't there. So if you hear registered apprenticeships, the first thing individuals would think about is the construction and trades. They won't think about registered apprenticeships in healthcare, IT, manufacturing, telecommunications, any of that. Soon as they hear registered apprenticeships, they immediately go to the construction and trades. So when I took this position 3.5 years ago, I had to learn how to talk to these individuals. I can't go and talk to a university like I would talk to someone at the state level because they don't speak the same language. So some of the challenges is that communication piece. What is it? What is the why you're asking me to do? Why you're wanting me to do this? What it is you want me to do? Another challenge is a lot of, and I don't want to get in trouble saying this, but a lot of deans, they don't see the benefit of a registered apprenticeship. And they're not talking to industry to learn how we can bring their students into the career. So they're teaching them the methods, they're teaching them what they need to pass on the NCLEX. But when those individuals graduate, they're leaving the field way quicker than they're entering into the field because no one is actually really preparing them for the workforce. Another challenge they're passing the NCLEX again, but they're not staying in those positions. And you didn't been in nursing school for 4 years. You done made your parents proud. It was a big accomplishment. And then the minute you get into being a nurse, you're not ready.
Mm-hmm.
Then there's the help. There is a lot of universities and colleges don't know that entities like HCAP exist. We can help them build and learn about a registered apprenticeship program. When I was doing some work out in Tennessee, we had a whole task force to get the nursing program approved by the Board of Nursing. We have to get out of thinking the old way and start thinking the new way. And this is what I'm seeing a lot of institutions struggle with. They're like, this is what we've been doing for up 10 years, but that was done in the 50s and the 60s and the 70s. We're in 2025. We have to do things differently. We have to meet people where they are. You still have institutions out here telling individuals once they get accepted into nursing school that they cannot work. Where can someone not work in America in 2025 when gas is $12 a gallon, eggs is $40 a carton, and milk is $50 a gallon? So it's just like as long as you have a horse and some chickens, you're fine. But if you don't, you have to work. And institutions telling nursing students that they can't, it's impossible. So the challenge is that communication, it's giving them the reason behind why it is the help that is available for them because we can help them get from point A to point B all the way to registration to implementation to launching. It's just they need to just answer the phone, answer an email, ask for help. You have people in your prospective states that will help you and hold your hand throughout the entire process. It's just you have to welcome us in. So that's some of the challenges. And then also the paperwork. A lot of people think it's a lot of paperwork, but again, if you partner with entities like HCAP, we'll be able to help you shuffle that paperwork with you. And you have states like Arizona, Tennessee, Texas that have apprenticeship training representatives at the state level that will help you with that paperwork. So the help is out there. It's just like invite us in. Let us educate you on the apprenticeship model. Because like Mallory said, we're not trying to take away the degree. We're not. We're just trying to get more people in that talent pipeline so we can fill this shortage.
Perfect. Absolutely. Thank you for sharing those challenges. Now I want to pivot to Madeline. So what advice would you give to institutions of higher education to break into the apprenticeship space, knowing that red tape comes with various state to state and or credentialing body regulations? As I think it was you mentioned earlier, it's highly regulated industry. And will you share a bit about your success in helping these institutions with their program launch?
Sure, absolutely. I just wanted to make sure I wasn't on mute still. Yeah, we've spent a lot of time working with higher ed and ensuring them and their customers that they can develop the curriculum for a registered apprenticeship and still meet quality standards and the highest credentialing standards One thing we did is Joy had connected us with a hospital in Louisiana that really wanted respiratory therapists. But because of the credentialing of how education is developed through COARC, which is the credentialing body for respiratory therapist education, it was really challenging. So we actually went to COARC, had conversations with them to say, how can we adapt your regulations so quality education is still being developed and delivered, but you make a pathway for registered apprenticeships. So there, I think still they've submitted things for public comment. I think that's still under review and should be released soon to develop more clear pathways for registered apprenticeship in that desperately needed occupation. And between Joy and I think we've talked to probably a dozen or more nursing boards in the United States that have had concerns, and we've been able to alleviate those concerns most of the time. So I think just opening the conversation is really, really important. I started doing apprenticeship work in 2015. And, Montana is a huge state, right? From one corner to the other is the same distance as New York to Chicago. And I really talked with our local colleges and university to allow their curriculum to be developed distantly, because a lot of apprentices can't move. They have ties to that community. They either have a ranch or farm or kids in school or, parents they're taking care of. So a lot of the colleges really struggled with putting curriculum online until COVID hit. And then that really transferred, that old butts in seat model to how can we develop this great curriculum, but distantly. And I think having online and in-person didactic education is important. Having asynchronous and synchronous training, providing clinicals in alternative locations, and the educational institutions have to be flexible with their apprentices. Apprentices tend to be older and come from underrepresented and underserved communities more than the traditional student. And like Joyce said, there's very few people now who can put their lives on hold and pay for a college education and still keep up their lives. So how are colleges going to adapt and be flexible, not only to the employer and what they need, but to the student, to the apprentice?
Okay, thank you for that. Mamie, so in your experience of founding and implementing innovative models to expand the nursing pipeline, what strategies were most helpful in helping you launch your apprenticeship?
Joy and Madeline have pointed out a number of them, so thank you. I won't have to talk as long. But so thank you for that question. The program that I think most exemplifies kind of all the key elements that you would need to be successful was the in-house medical assistant training program, which was a facility-based model which supported entry-level workers, our patient transporters, nursing, environmental services, nutrition services, and the like, to earn a medical assistant credential while employed, and to Joy's point, and we all understand, and being paid to learn in the work environment. And so learners were trained on the job, and they attended classroom sessions through a partnership that we developed with a 2-year institution. And that 2-year institution offered both the LPN training, 2-year ADN RN program, as well as this medical assistant program. And so what we had to do, some of the key elements were to devise and articulate a clear strategic vision, the why, what were the program goals, so that everyone understood what we were trying to achieve. And then we worked very closely, and I helped with this collaboration. It was not mine. I'm not trying to take credit for it, but worked with it. But we mapped the competencies that our healthcare facility needed with the competencies and the coursework that was offered at the educational institution. And so another key element is to build deep, very deep employer partnerships so that, you know, we are talking to one another regularly. Convene a hospital, clinic, workforce education partnership where you all are meeting so you can co-design this program. And that way everyone has this buy-in for it and they have, you know, a need to want to see it to be successful. And of course, you know, the random things you have to ensure you have MOUs, memorandums of understanding, which outline, you know, funding and cost and, you know, who's responsible for clinical placements and preceptor roles and the like. We work to integrate classroom and workplace learning. It was, as Madeline pointed out, after COVID. So I think many people, you know, realize that, you know, these things are possible and doable. And nursing is a traditional field. And so sometimes we do hold on to things until evidence shows us otherwise. And so we got to see with COVID that, you know, asynchronous learning is a successful way to teach folks. So working on integrating classrooms and having some of the coursework done on campus at the healthcare facility where we have labs as well. So we had blended modules with the preceptors that they were then the learners able to earn credit. And then we use real-time performance data from the preceptors and mentors to be able to pivot. So any program like this, you need continual touch bases, and you have to have a clear understanding, everyone, of what the expectations are. So, you know, having robust peer cohort coaching. And you also, one thing that we learned after first cohort was that you have to have robust wraparound supports. Joy pointed it out really well. You can't leave your job, but there are other needs that folks will have that if you're wanting your program to be successful, the learner to be successful, you have to think about things like transportation stipends came up. We're in Nashville, which is a larger city, but sometimes our transportation is not as robust as we need it to be. There was a need for some additional tutoring, so digital tutoring for some folks and the like, just a number of things to think about in terms of what the learner will need to be able to be successful. And so many programs like this launch and they fail, unfortunately, because there's not that co-design phase. We really lean into ensuring that everyone who was a stakeholder who had some buy-in with the program was at the table during the design. It's very, very critical to do that. And to underestimate that need is really, a mistake. And then ensuring that you have those wraparound services for the learner will be important as well. So you don't just launch the program, but you have to have a vision for it and ensure that every stakeholder understands that vision, what they're helping to design, and then they can take ownership of it and ensure the success of the program.
Can I say
Awesome.
something?
Oh, go ahead.
For that,
Yes.
just to chime in, one of the challenges that I forgot to mention, and I want to thank Dr. Williams for bringing up the employer partner piece, is that some institutions will just go out and build a program without employer partners, and that's the wrong way to do it. I don't even know how you're getting your program approved and you don't have that employer partner. So, like Dr. Williams said, you need to have that employer partner at the table when you're wanting to build a program. If you're not building nursing, and you want to build a medical assistant, your employers may not need medical assisting. They may need surge techs. So you need to, again, that communication, you need to talk to your employers to figure out their needs and stop looking at like some of this data, because some of the data is not up like 2025 data. We're probably looking at 2022 or 23 data. And when we get further into the questions, we're going to talk about additional stakeholders. But one of the biggest challenges that I have to like try to help with colleges and universities is do not do not try to get a program approved without an employer partner. You will have the hardest time trying to recruit employers with an approved program than you would if you're recruiting employer partners before you even start building out a program.
That's a great point. And that's one thing that I've just seen in my work in workforce is that what you alluded to earlier, Joy, about high institutions of higher ed not speaking workforce and workforce not speaking higher ed. If you don't have them at the table, they know what they're hiring for, they know what they're looking for. So as institutions of higher learning, you should be listening to who is going to be hiring your folks, right?
Yes.
Great responses. Thank you so much. We're going to skip down to, I want to talk to Madeline a little bit about what your perspective is on best supporting the apprenticeship model from the perspective of a stakeholder, because that was a great segue into that. And we're going to drop in the chat a link to your HCAP mentor training slide. But I want to ask you about your perspective of a stakeholder and an institution of higher education. Will you share with us a bit about your approach with mentorships?
Yep. And I think mentorship is, I mean, I hate the term secret sauce, but I think it really is a component of registered apprenticeship that really makes a difference. You know, we talked about earlier about sure the apprentice really understands what the work is, and the mentor is really there to do that. You know, there's the 7 key components of a registered apprenticeship, and I'm convinced that the mentor is the most important one. In fact, when I worked for the Montana Department of Labor building apprenticeships, I stole the HCAP training on mentor training just because I thought it was so important for our healthcare facilities to get that. And one thing that I've interesting is there's an organization that did a study on mentors and found that they were more engaged employees. They felt like they were better trained to do their work. And a lot of these mentors were seasoned either nurses or CNAs who had been doing this work for a long time. And they got a lot more job satisfaction from being a mentor as well. So I think that's a really important thing. You know, I was just in a meeting this morning that the Montana Public Health Institute put together on workforce and in Montana with the healthcare systems. And they were talking about the 3 things that really came up were recruitment and retention successes. You know, what's your employee satisfaction and how do you connect with higher education? And I think with apprenticeship, it kind of puts all of these things together. You know, the stats at the beginning that apprenticeship really increases retention is really good. And I also think that with some healthcare professions, there's been this tendency of eating your young. I have a good friend who's a master's nurse and has been in nursing education and has worked for many different nursing boards on some things. And she said that's how it was, you know, that nurses eat their young. And I think that mentorship can flip that script. And how is it that we can take these new young healthcare professionals and really make them feel comfortable? You know, Joy alluded to a lot of people go through a nursing program, spend 4 years and how much money, and leave the profession within a year or 2. And I would guess that if they had a good mentor, that would look different.
Absolutely. Absolutely. Thank you for that. I want to switch gears
to add real quickly to that. I apologize. Madeline, some colleagues and I are working on an incivility in nursing program, and you point out very well, mentorship is very important to the relationship. We have to have trained mentors and we have to train the mentees as well to understand what the relationship can do for one another. But I agree with you wholly. And that was one of the things we found in our MA program that we had to work on, was educating the preceptor / mentor and the learner so that we were all in sync with what that relationship was to do. But it most certainly will help with some of the ways in which we're not as kind to one another as we should be. So thank you for that point.
No, I appreciate your ladies' insights on and perspectives on that. Now we're going to switch gears to something that's important to everybody, because to do any of these things, we have to have funding. So somebody's gotta unlock some money for us. So to launch and scale any program, funding is a crucial factor. So we're going to explore the topic of braided funding. Before we do that, we want to hear from before we hear from our panelists. Let's talk a little bit to the audience and get their perspective. Put in the chat for us what funding sources you have already tapped into or wish you could tap into to support your apprenticeship programs, or drop some ideas that you may have in the chat. And while you do that, I want to ask Madeline, can you share share with us some of the common barriers and opportunities that you have helped educational institutions navigate while launching and growing healthcare apprenticeships?
I think part of it is there's times I've been working with an education partner and they say, we're going to do this apprenticeship without knowing what the needs are. And I think Joy mentioned that too, that it's really important that you really understand what your community's needs are before you decide to do a registered apprenticeship, and what the bandwidth is and what other supports you might need to offer either the apprentices or the employer partners before you begin. Don't try to solve a problem that isn't there.
Right. That's a great point.
The other thing with apprenticeship is it can be flexible. There can be things brought into it that might be more important to some employers than in others. Like I have worked with some tribally owned healthcare facilities, and they really want to have people that have some cultural competence when working with their individual tribes to make sure that either their residents or patients really feel connected to their healthcare centers. So that's really important. And then I think the other key thing, and both Joy and I have had this happen several times, is we're talking to a partner who's really engaged and really excited and really wants to do apprenticeship and is the driver in that facility, and then they leave. Mm-hmm. So then you are starting from scratch with somebody who may not know anything about apprenticeship, but we're just given here's another thing you have to do in your new job. Mm-hmm. So have more than one person in the room that is excited and engaged and wants to pursue this.
That's awesome. And that's a great piece of advice. Mm-hmm. Joy, I want to ask you, can you share some of your simplified step-by-step processes for helping people to gain access to braided funding?
So when I meet with educational institutions, it's, this is my home. This is the first career I stepped into. And, they know everything institutional wise, but they don't know what's going on outside of those gates, right? So we have something called workforce development in the real world. You may have a workforce development department at your institution, but it's totally different from what we have outside of those gates of your institution. So I would tell them to tap into that. Majority of the students and our apprentices may qualify for WIOA, which is the Workforce Innovation Opportunity Act funding. They're also have a bill out for career Pell. I wish that would have happened 20 plus years ago, but hey, it's better late than never. But there is resources that you'll be able to tap into. So once we get this institution to the table, once we have the employers at the table, once we figure out the need that this employer need, if they're needing medical assistants, surgical techs, respiratory therapists, whatever, then we start actually building. And then we start looking at the mentors, listening to worker voice, asking the mentors what they want to see in this training so we can be able to relay that back to the educational institution, and then bring in workforce development, bring in the state apprenticeship agency of the Office of Apprenticeships. We try not to bombard the university with everybody, because when I'm coming with the whole cavalry. I have everybody in my backyard on speed dial and saying, okay, we got to get this institution ready. But
Yes.
before we go, I'm gonna go by myself first, and then I'm gonna bring everybody on because we don't want to overwhelm this because it will become a lot, and you will
Mm.
see that you didn't know about the resources. So tapping into workforce development, tapping into the state apprenticeship offices and your offices of apprenticeships, you have a lot of state funding that is being geared towards on the job learning and work based learning and apprenticeships. Yes, you do see cuts in WIOA, but those cuts are going towards, looks like it's pivoting to registered apprenticeships. We haven't heard anything coming down the national pipeline, but there are things in your area that you'll be able to tap into. I just got an email out of the state of Kentucky for their initiative. They have an RFP out. They have one in Tennessee. They have one here in Texas. So the funding is there. You just have to know where to look. And the first place I would tell them to do is one, look with your workforce development, your American Job Centers that's near there. They can help with that wraparound services that Dr. Williams said, that transportation, childcare, rental assistance, all of that to help this person still become successful. And then the state apprenticeship offices and your offices of apprenticeship, I want to give a shout out to one of the state directors, Miss Joanne from the state of Arizona. They're there. They're there to help you. And then you have all of these other grants. Like we're working with a lot of GWEB grantees, and they have a portion in their grant that has to have a CNA registered apprenticeship. So tapping into those types of resources, and we're not going to find everything, but that's how that communication, I keep it open because I'm here in Texas. I don't know what's going on in Tennessee. I don't know what's going on in Florida, but I do have connections there to let me know when we get started and ready to start building out this program, where is the funding? Where is the funding? And then I also have to let the employers know too this, you can afford this, employers. You can. Something called tuition reimbursement. We just have to make sure the educational institution can accept that funding after they finish, because with tuition reimbursement, we know how it works. We got to get our grades before we get reimbursed. It's time, I tell the employers, it's time we need to change that, because if you want to implement a registered apprenticeship program, that's your first set of resources right there, that tuition reimbursement. So step by step, one, contact your local workforce departments and at your American Job Centers. Two, you have to contact your state agency, apprenticeship offices, or your office of apprenticeships. And then also private funding is also coming down the pipeline. But again, if you need assistance with any of that, here at HCAP will be able to help you tap into and find and locate those funds.
Awesome. So many great ideas and thoughts on different resources. But if you're looking for more, I want you to check in the chat for a braided funding guide from Craft Education. It's a little cheat sheet on funding apprenticeship programs. So feel free to grab that before we go. Now I want to drop into, because we're winding down here. We have just a few minutes left. I want to thank all of you ladies for your incredible perspective and what you brought to the table in terms of stakeholder engagement, impact, and funding. And before we move on to our summative reflection and questions, I'd love to make room for any questions that any of you may have today from the panelists. As a reminder, you can drop them in the chat or the Q&A box as well. So don't forget to do that. And while you're dropping your questions, I'd like to do a little reflection with the panelists. What's one piece of advice that you would love to give to others currently growing or scaling their educational institutions' healthcare wraps? I'll start with you, Mamie.
I think the one thing that I've taken away from the work that I've done is that you have to be ready to pivot. You can start off with the most succinct and well laid out plan, and small things can derail you. So have the ability to pivot, and in order to pivot, you have to have these regular check-ins. So setting up whatever program you implement, ensuring that you have a way, you've identified what metrics you want to use, and you have a way that both you and the team are looking at those metrics and then using that to iterate your program and adjust and adapt so that it can continue to be successful. What you put in place initially might not be the exact way that it ends. So just be ready to pivot.
Okay, that's great advice. Madeline, we'll ask for you.
I mean, I think that implementing apprenticeship programs seems daunting, but there is help. And apprenticeship changes lives. I mean, I've talked to the one that sticks in my mind is an apprentice who, because of the apprenticeship, was able to move her and her kids from living in a car to an apartment. And, you know, she talks about what it was like to walk in that apartment for the first time and know that she had a home and her kids were safe. And there's thousands and thousands of stories like that across the country on what apprenticeship can do for individual people.
Absolutely. Great. And last but not least, Joy.
I say do it because apprenticeships change lives. It changes someone's aspect on life. It gives them that opportunity, not picking school over work or work over school. It's not a either or, it's a both. And if you do it, it's not about the clout, it's not about the numbers, it's not about the challenges. Anything that you do, you're going to have challenges in it. Anything you do is going to have paperwork in it and all of this other stuff, but just think about the success of it. Think about the young lady that Madeline just mentioned that walked into her first apartment. Think about the young man that didn't have two nickels to rub together and now he has his first paycheck. Think about the generational curses that we're breaking. Think about the barriers that we're breaking down. Think about the joy, no pun intended. Think about the joy that's going to be on those individual lives when they start their career. Someone finally said yes and gave them the opportunity. So it's not about me, it's not about us, it's about them. And this is the success of a registered apprenticeship program. So I tell you, if you're thinking about doing it, stop thinking, let's meet, let's get our employers to the table, let's get all our funders to the table, and let's move forward because this is the only way that I see, this is just Joy speaking, that I see that we can help with this skills gap we have and with this shortage that we have in the healthcare system.
Okay, great. Thank you for that. Those are all, I hope you all were able to take notes on those nuggets because they were great nuggets. Continue to drop your questions in the Q&A. We have one here, and I'll open this up to any panelist that wants to chime in. What strategies have you found most effective for getting employers not only to sign on initially, but to stay committed as partners over time?
I can
Bring joy.
start with that.
Okay, go ahead, Mamie.
Okay. So I want to point out what Madeline did. The story she told, the qualitative narrative she told about the experiences of the learner was very heartwarming. That is one of the ways you can bring workforce partners and healthcare providers together, telling those real life stories about the impact that apprenticeship in these programs make. And that is a key to success. You have to get that out there, into the ether. Folks have to understand just how impactful, these things can be. You also, again, I can't stress it enough. You have to be, with those partners working. And Joy said it as well very early on, hand in hand to outline what your program and partnership will look like. So as long as you do that, you go to them with this openness to be willing to think about, competency hour rather than just, clinical time in the seat. And the like. I think that will open you up to having partners willing to partner with you. And just using the skills that you have around, I mean, you're educators, you have this wonderful skill around telling stories. Get those out there and they will be engaged with you.
That's awesome.
I was
Oh, go
I'm
ahead.
sorry. I would
Go ahead, Joy.
say host events. Like employers are hearing this too. And the reason why they're not coming to you is because probably They tried to call, they tried to email, and they didn't get an answer, or they talked to someone that's not there anymore. So again, that communication. So we host events. I just moderated a panel at the DFW Apprenticeship Accelerator last week, and we invited employers, and these were there. They were expressing their concerns, like, what is this? Why should we do it? And we had the talent in the room to be able to help move the needle forward with that, with those employers. We had the employers that was doing it. We had the employers that were thinking about doing it. We had the employers that was like, I don't know about it. But if you look at it, employers are already doing some type of training, right? So why not say, hey, why don't we register this program and we can open this opportunity up to get additional funding, to get more recognition, to expand the programs that we already have. And, it's a simple conversation. So I
Mm-hmm.
think, like, if you host an event and not have it be long, as if you feed them, they will come. Like I said, if you build it, they will come. If you feed them, they will come. And just talk about what is registered apprenticeships and their role in the apprenticeship model. Because a lot of employers, we have to keep in mind, they don't have the resources right now to run it. So what are some other ways that we can do an apprenticeship with this employer? Or who's another sponsor they can sign up on, up under? So providing those resources and those tools to that employers to say, okay, yes, we can do it, and we'll stay because we see the success.
Joy, we had another question for you. What are your experiences in providing additional compensation for mentors, preceptors, especially in the fields like nursing, where they are balancing it against a large work scope?
So when we have funding, HCAP did have funding in our contract, and you can utilize that funding for preceptor mentorship training. Again, that's when you can tap into those resources at the state level. And whenever the national funding come down the pipeline, you may have funding that you'll be able to give incentives. We're not telling you to break the bank. And this is the conversation the hard conversation that I have with my employers. Stop saying that you can't afford it, because you can. You're driving a Bentley, sir. How can you afford that Bentley? And most of your employees are catching the bus. So if you offer them $1 more or $1.50 more, and have them particularly work with this apprenticeship as a mentor or a preceptor, then that'll be great. You're not bringing in apprentices at the starting nursing rate or the starting medical assisting rate, because they don't have that experience yet. We're getting them that experience to lead up to that starting point. So something as small as an incentive, something as small as $1 more or $2 or $3 more in their salaries or in their hourly wage. I've had an employer that even said, okay, if you do this, we'll give you additional days off. And I'm like, wait a minute, I want to do it too now. Cause like a lot of nurses don't have that luxury of just taking days off sometimes. So we have to be creative. And I say when we are talking about paying mentors, that's one of the hardest conversations that we have, but we figure it out. We can tap into workforce development, we can tap into the state resources as well, and then also try to find funding that this employer probably had to the side or budgeted, and utilize that funding for the mentors as well.
Perfect, perfect, perfect. A big thanks to all of our panelists. Thank you for joining us today. We hope that we were able to spark some new ideas for you launching and growing and scaling your institution's healthcare apprenticeship programs. Before you go, we put up a QR code there for you to take a survey, a quick survey. We'd love your feedback. We did drop in the chat, somebody asked the best way to get in touch with HCAP for TA. So we did put, or thank you, Madeline, for putting you and Joy's email there. But we again want to thank you for your time. You all will receive a follow-up email for today's webinar with the recording and any unanswered questions that we weren't able to get to during our time with you today. So with that being said, thank you all for being here. Thank you. Give a round of applause to our lovely panelists. If you have any information or want to know more about what we're doing, please email info@crafteducation.com. With that being said, thank you so much for your time and have a great rest of the day.